Hi everyone, Dr. Samir Rahman here from Connolly Hospital, BLANCHARDSTOWN. I'm working at SHO anesthesia via CPSP HSC training program. I'm going to present my study titled as Adherence to the Practice Guidelines for Postoperative Epidural Analgesia. So, the aim of our study is to evaluate the adherence to the practice guidelines regarding the insertion of epidurals and the different doses and concentration of local anesthetics used in it, among with the complication rate and patient satisfaction. As per the literature, the neuraxial techniques are proved with being having less morbidity and mortality when compared with the opioids and other analgesic techniques. Post-operative pain control is associated with increased patient satisfaction, improved pulmonary function, early recovery of bowel function, less thromboembolic events, less bleeding, early mobilization, and decreased financial strain. This study was done over the period of 3 years at Dr. Hospital and Medical Center, Lahore, Pakistan, using the non-probability consecutive sampling. Patients who were expired or being admitted to the ICU were being excluded. Here are the results. Out of the 308 patients who were being inserted epidural catheters, 200 of them were inserted at the correct level as per the Barrage textbook of anesthesiology, and 108 were or not. In 108 patients, guidelines were not followed. The most common drug used was bupivacaine, and the most common concentration used was 0.1% bupivacaine, followed by 0.125%. And among the patient satisfaction, the excellent satisfaction is being labeled in 194 patients, and satisfactory in 94 patients, and one patient has a poor experience. Among the complications, the overall complication rate was 12.98%, with the most common being the temporary motor blockade that resolved on holding the local anesthetic infusions, followed by the dural tap and catheter pulled out being the third most common. The most common drug concentration, as described previously, was 0.1%, followed by 1.125%. That is in correlation with the study done by Faraz et al., who has used 0.125%. And patient satisfaction in our study was 93.5%. That correlates with the study done in Sweden, where the patient satisfaction was 87.9%. Most of the epidural catheters in our study were kept for 2 days, followed by 1 and 3. This practice was a bit different from the described one by the Faraz et al., where most of the catheters were kept for 3 days. The overall complication rate was 12.98. This is in comparison to the audit done by Faraz, where the complication rate was 26.5%. The limitation of our study is that it is a single center study and its retrospective nature. We hope that this study will help in improving the surgical epidural analgesia practice, not only at our center, but also globally. So we need to make stringent protocols to make people follow the recommended guidelines, not only for epidural insertion, but all the doses, concentrations, and proper documentation and follow-up of the surgical epidural patients. Thank you so much.